Well, this unit is a great improvement in cancer care right across our district. It's a fantastic addition to the medical facilities of the district. It's very new, so it has the latest kit within it, and I've been meeting patients today, been meeting some of the clinicians who are working here. They're both reporting it's an absolute step change from everything that they've seen previously, and they absolutely love it. It's very light, very airy, there's much more privacy, much more space. So it's a real enhancement and very positive news that's open. And there's a further key benefit too, which is that this is a partnership between the local foundation trust and Macmillan. So there are Macmillan staff here, and they're able to provide some of the care which goes around cancer support, some of the care perhaps on the benefits system, or on the more broader support about people's lives and the challenges that facing cancer can bring. And this whole unit really is about a whole collective of support, not just the treatment itself, and that really is the key idea of the whole partnership.
I've found coming over from the new units is the feedback from the patients is that when they're coming in for the treatment now, it's a much calmer environment, whereas before we were all tripping over each other really with our equipment and lack of space. Now each patient's got their own personalised patient area to sit in, and each nurse has got their own equipment that they can use for the day, which makes it for a much calmer experience for the patient. And that's the feedback we're getting from the patients is that they feel really relaxed. They feel very privileged and valued to have all these lovely chairs to sit in, and they say that the nurses seem a lot more calmer and relaxed as well whilst they're giving the treatment, and that means that we've done the job right and that the building is fit for purpose and exceeds all expectations, and we're just very proud of it.
So one of the things we want is to do much better at cancer as a nation. We've invested a lot of money, this government's invested a lot of money, £750 million over this spending review period, much of that on diagnostics and other aspects of care, but still we want to do better. We're not amongst the best in Europe, and we want to be. So one of my interests in coming here was to understand about how, for example, they've brought together not just the clinical care aspects, but also the things that go with it, sort of the holistic aspect of caring for people. I respond to a lot of debates in Parliament about cancer where people talk about dealing with someone's worries about benefits, for example, or people's worry about getting other treatments, complementary therapies, dealing with the challenge for a woman of losing her hair, all of those things, and actually seeing that brought together here, both the purely clinical care, but also all those ways in which the person is supported at a really difficult time in their life. It's been very interesting to see that, because as I say, a lot of the challenge around our care for cancer patients is around some of those other aspects, and this is the first time I've seen it brought together like this, because they could plan from scratch in this new unit, and to see that sort of whole person care has been really exciting and really, really interesting.